Have you heard about the word gestational diabetes? Well, gestational diabetes simply means diabetes in pregnancy. But before we proceed, I remain your favorite doctor, Dr. Scott DC. Before pregnancy, these women tend to be fine in most cases. However, following pregnancy, they begin to have symptoms that might suggest that they are diabetic. By urinating frequently, they tend to have fever that might suggest recurrent infection due to excess sugar accumulating within the body, suppressing the immunity. And they tend to eat too voraciously, they drink too much water frequently, they urinate, and then they tend to see and gather the urine. And eventually, when they register for antenatal, the doctors assess their urine. They tend to notice there's glucose in the urine. They do a fasting blood glucose for them and realize that there's uncontrolled or elevated level of sugar within the blood. This is a condition that can actually endanger both the pregnancy and the mother's health. It prompts the mother to having recurrent infections. And so she can come down with febrile illness that can endanger the pregnancy, can even cause abortions or miscarriages to the baby because the baby is exposed to excess sugar within the body. So the tendency that the baby tends to feed so voraciously and grow too big. So this becomes a problem during delivery when the baby finds it difficult to negotiate through the birth canal. So you tend to have obstructed labor because of the big size of the baby. They're at risk of recurrent infections. They can have hypoglycemia. That means the blood sugar can suddenly crash. And this can kill them faster than any other problem. They're at risk of having jaundice, hypothermia. As a woman during pregnancy, you notice these symptoms that might suggest that you have problems with glucose control during pregnancy. Please kindly ensure that you follow up with your routine antenatal appointment and ensure that you comply to your medication to avoid this series of complications during pregnancy and after pregnancy.